Picture this, you're just going about your day, everything's totally normal, and then bam, a sharp pain in your chest and you suddenly can't catch your breath. It sounds like something out of a movie, right? But it's a real medical event, a spontaneous collapsed lung, and we're going to get into exactly how and why this can happen right out of the blue.
I mean, that's the central question, isn't it? And it's a terrifying one. No injury, no car accident, nothing you can point to and say, that's what did it. The lung just gives out. And look, this isn't some hypothetical scenario. It's a real condition, and understanding it starts with its name.
So when this happens out of the blue, what's actually going on inside the body? Well, doctors have a specific medical name for it, and it's called, you guessed it, a spontaneous collapse. And here is that official term, spontaneous pneumothorax. Now, pneumothorax is just the medical word for a collapsed lung, but that first word, spontaneous, is everything. It means there was no outside force, no trauma, no injury. It just happens.
So how does a lung just collapse on its own? You know, the easiest way to picture it is to think of your lung as a balloon. A spontaneous pneumothorax happens when a tiny, weak spot on the lung surface suddenly springs a leak. Air starts seeping out into the chest cavity, and just like a balloon with a pinprick, the lung can't stay inflated anymore.
But here's the thing. This condition isn't a one-size-fits-all kind of deal. It actually shows up in two very different ways, and it tends to affect two totally distinct groups of people. So let's break down the difference between a primary and a secondary collapse. And this really lays it out perfectly. A primary collapse happens in lungs that are otherwise totally healthy. We're talking a clean slate. But a secondary collapse, that's different. It happens in lungs that are already dealing with some kind of disease, which, as you can imagine, makes the whole situation way more serious. So first up, let's talk about the primary type. Remember, this is the one with no underlying disease. And what's wild here is the typical patient profile: tall, thin, young men. So why them? Well, it's often caused by these tiny air blisters on the lung surface, called blebs, that suddenly rupture. And for reasons we don't fully get yet, this demographic just seems to be more likely to have them. Okay, now let's flip over to the secondary type, and this is a whole different ballgame. We are not talking about healthy lungs anymore. This happens to people who are already fighting conditions like COPD or cystic fibrosis. Their lungs are already working overtime, so a sudden collapse isn't just a problem, it's an absolute medical emergency. All right, so all of this leads to a very practical question. If this were happening to you, how on earth would you know? What does it actually feel like? Let's go through the key signs and symptoms that you really need to be aware of. It really boils down to two classic, unmistakable signs. First, a sudden, sharp pain in your chest. People often describe it as a stabbing feeling that just makes you stop whatever you're doing. And second is dyspnea. That's the medical word for a really intense shortness of breath, that sudden, terrifying feeling that you just can't get enough air in. If you get those two things together, out of nowhere, that is the major red flag. Now, if you do experience those symptoms, and that sounds incredibly scary, the good news is that there's a very clear and well-established path for treatment. Doctors have a logical set of options, and they range from just simple observation all the way to more direct intervention. The approach is really step-by-step. A lot of times, it starts with simple observation. If the collapse is small, sometimes the body can actually heal itself. But if it's bigger, doctors move to step 2, a chest tube. They insert this small tube to gently pull out the trapped air, which creates a vacuum and lets the lung inflate again on its own. And for the most severe cases, or if it keeps happening, the final step is surgery to go in and permanently fix the source of that leak. All right, so I think we've got a pretty good handle on spontaneous pneumothorax. But you might have also heard the term simple pneumothorax. Are they the same thing? Well, not quite. A quick comparison here will really lock in what makes the spontaneous type so unique. Looking at this chart, the key distinction just jumps right out at you in that first row: the cause. A simple pneumothorax can be caused by an injury, like from a broken rib, but a spontaneous one, by definition, never is. And notice that last row on treatment? While the tools are the same, the urgency is completely different. If there's a secondary disease involved, doctors have to be way more aggressive because the stakes are just so much higher. So let's just boil this all down. A spontaneous pneumothorax is a shocking event, for sure. A lung that collapses for no obvious reason. It can happen to perfectly healthy people, which we call primary, or it can complicate an existing illness, which is secondary. But the most important thing to take away is that even though it happens out of the blue, the path to getting better is clear, it's logical, and it works. So now you know all about this pretty surprising medical condition, from what causes it to how it's treated. It kind of makes you wonder what other mysteries of the human body are just hiding in plain sight. And that brings us to our final question for you. What's a medical mystery you think we should tackle next?